Hello, I am Dr. Bishwash. I am a doctor of this clinic.
Yes, doctor.
I confirm that you are Miss Layton, Mr. daughter of our patient, Mr. Ronan Roche, a 72-year-old
Yes,
gentleman.
yes, doctor. Yes.
I came to know that you wanted to talk with me. Is it right?
Yes, doctor. I want to talk about some issues of my father's management.
Okay. So, may I know that is there any specific issue that you want to know or you want to discuss?
Well, doctor, actually, while I was talking to your staff this morning, they told me that you're planning to give him a specific tube or something like that. It was a PG tube. It was such a big name. I'm very afraid. What is this, doctor? And my father is already burdened with so many problems, and you are trying to do another thing to with him. So how will he manage, doctor?
Yeah, I can understand that you love your father very much. And before I answer your question, can I ask you a few questions?
Yes, doctor.
Yeah. So may I know that how do you know about your father's condition?
Well, doctor, I know that he has had a very bad stroke, I think, and he was admitted in this hospital. And that's all, doctor. And I think that he is not so good actually. He has already been some. There has already been some tube given through his nose, I think, and he's already burdened with so many things. So again, you are trying to giving him another thing. So I am afraid, doctor.
Actually, I can understand your concern. Actually, your father was admitted to our hospital with a stroke. That is, some part of his brain has been affected by this condition. For this, he cannot uh, eat or cannot drink anything. That has become impossible for him due to this disease. Do you get me?
Oh, really, doctor? Is it so bad?
I'm sorry to say that actually at this time it is impossible for him to take food through mouth because taking any food through mouth can complicate this condition. This can even come goes to the lung. This food can goes to the lung that can cause another problem.
Okay, doctor. Okay.
For this, we tried giving him food through a tube that we called nasogastric tube. That is a tube entered through the nose into the stomach, and that passes food through this tube. Because as his condition is bad, so at this time he also needs good nutritional support, good food, but that cannot be given to him by and also he cannot eat, he cannot chew, or he cannot swallow. For this we needed that tube. Do you get me at this point?
Well, doctor, why cannot that be given with the tube?
Actually we tried tube several times, and the tube is coming out. And also, as I have told you that sometimes that food can goes to the lungs, and as this tube is coming out through from the stomach, this can sometimes goes to the lungs, and that can also complicate this condition. That can also bring another devastating condition for your father. I am sorry to tell you that.
Doctor, are you so considering this new tube because of that problems you're considering?
Yes, we have taken opinion from doctors of different specialists, and they said that at this stage it will be better to give him nutrition, give him food through a tube that is entered through his skin on his stomach,
Okay, doctor.
and we call this percutaneous endoscopic gastrostomy tube, Uh, Generally, it is known as PEG tube. PEG, PEG tube.
Oh, the name is so burdensome, doctor. How can I'm afraid. What will you do with in this tube?
Yeah. And actually, before giving this tube to your father, we have discussed this condition with you and the all the good what the or the pros and cons of this tube. And your father has agreed with us. So we are
Well, doctor, I have a question, doctor. Actually, he is so sick, and you have again wanted to take permission for him. Is he capable of giving any permission now at this moment? Isn't he burdened with his condition already? And you are again going to him to take permission from him?
okay. Actually, I can understand that you love your father very much, and so you are concerned for him. Actually, we took this decision for his best interest because our consultant, our senior doctors have seen him, and they think that at this time that will be a bit most important option to give him food and nutrition. And also your father's condition was assessed by the senior doctors, and it was assessed that he can give the consent for this.
Okay, doctor. So you are telling that this tube should be given now. Can you please, actually, can you please tell me that how is this given? I'm actually a bit worried, doctor. If you don't mind, can you please tell me?
Okay, it's my duty to clear it to you. Okay, actually, this is a tube that is given through skin on our tummy. Okay, our stomach is just somewhat lower than our ribs. Do you get me?
Uh, can you please tell me again? I have some problems understanding this.
Okay, will it be better if I draw a picture for you?
Yes, doctor, I think so.
Okay, so that you can see that here is our tummy and here is our chest. Okay,
Yes.
and below the chest, here this tummy, there lies the stomach
Okay.
or the skin. Okay,
Hmm.
and
Yes. Yes.
as your father's stomach is good and the stomach can take food and can tolerate this, so we
Yes.
can pass food through this. And we also previously tried by giving the tube through nose, but that is not tolerated. So we are trying another method, that is we are going through skin to reach the stomach.
Okay. Now I'm getting it a bit more, doctor. That's good. But okay, I get it. And now you're telling that you can introduce that tube now. Then okay, you can now give all food to him at that time?
Okay, actually, this tube is a narrow one, so everything can be given, but just after blending it.
Just after what?
After blending it, that can pass through
Okay.
that.
Okay. Okay.
Do you get me?
Well, will he feel any pain?
Okay, actually, we'll do it under the numbing agent. We'll give him the numbing agent, and during giving that numbing agent, he will feel a little bit pain, but that is very negligible. And after giving the numbing agent, there will be no pain, and it will be done by very expert hand. So there will be a very little complication.
Okay. Okay. That's good. But well, I have another question actually. This tube can be actually can be seen. So am I right?
Yes, it can be seen, but it is a very short tube, and we can use some adhesive products that can also keep it under the shirt or under the uh, gauzes, so it cannot be visible from the outside.
Okay. Mm,
And, also, we will teach him, your father, and his caregivers, family members, how to take proper care of this tube. This tube sometimes need some maintenance, and
Okay, doctor. Another thing,
yes,
but will
please.
he need this tube for rest of his life?
Okay, actually, the tube through the nose cannot give nutrition for a long time, and the tube through the skin, that is called pig tube, that we are considering for your father's, it can be used for a long time. And if your father's condition improves, we will assess him regularly. If he can swallow, if he can eat food through his mouth, then we will go for uh, the next option. And in that case, if he doesn't need that, we will also remove this.
Okay. Uh, and you have what you have told so far, but these are all good things about this tube. But isn't there any risk in this?
I am not actually hiding anything. There is certain risk that during entering the tube, there can be some rupture to the bowel, and also there can be some rupture of the bowel when entering the camera. There can be some infection during that time, and sometimes
Okay.
there can be bleeding that can be severe enough. But we have good and very expert team, and the chance of developing this condition is very less.
Okay, doctor. And okay, and well, what if I am quite convinced at this moment, but yet if we does not to put him through this tube, what will happen to him?
Yeah, at that time, I am sorry to tell you that we cannot then maintain his proper nutrition, and that is important for our life. And if he cannot maintain nutrition, we can give him some injection through the blood channel, but that is not as good as this type of procedure. 2 minutes remaining.
Okay,
So
doctor. Another thing. Okay, I'm now getting a lot. It's helping me. Just one thing that you told that yeah, it may not be visible by shards. And another thing that uh, will he be able to do his jobs or do his works through the day if this tube is attached for fitting?
yes, we will take care of that. We will give him some adhesive garments or adhesive products so that he can keep it under the skin and with this position.
Well, and can he do his jobs, his normal works every day?
Yes, he will be able to do that.
Okay, doctor.
And can I ask you a few personal questions?
Yes, doctor.
Okay. And may I know that who is his caregiver?
Yes, doctor. I am his caregiver.
Okay. Actually, we will also teach you that how to take care of that. So, and we can also give you some products, some leaflets, some website address, so that you can get better idea how to take care of that. And also, we will teach you that what should be done in case of it is not seen, it becomes displaced, or what would be the problem that can arise from it, so that you can get a better idea, and then you can contact our department if any suggestion needed.
Okay. Okay.
Do you have any other question?
No, doctor.
Okay, thank you.
Thanks. Thanks a lot, doctor.
And if you have any question at any time, that you can always contact us.
Yes. Okay.
Thank you.
Okay, doctor. Thank
Time off.
you. Okay. Well, what was your task?
Okay, my task was to talk with our patient's daughter and meet her concern about the percutaneous endoscopic gastrostomy tube.
Okay. So, how do you think this conversation went?
Yeah, I think that I could have I have given her the information that she wanted, and I didn't burden her with the extra information like all the procedure and in details, and all the other options in details. I try to give her the answer that is more specific.
Yes, okay. In this case,
Do you want to add anything?
personally, I'm quite satisfied. I think that you have um, answered most of my questions, and actually, I had a lot of questions, and you actually answered that quite well. And one thing is that when I asked that can he do the jobs, I think you could have answered it in this way also, uh, that we would try to do all the feeding overnight. Okay, so the day is freed up for other things. Okay, so this can be an option for the patient. Okay, and when I ask that the tube will be obvious, so you can also answer that when your father is not attached to the feeding tube and back. Okay, then the tube lies close to the skin and is not usually visible under clothes. Okay, you could have assured in this way as well. Okay, and if the feeding is done overnight, then the feeding bag is not necessarily attached throughout the day, only the tube which is very close to the skin, so it is usually not visible under the clothes. So this could have been a much better explanation, I think. Are you getting me?
Yes.
Yes, I think this was one thing, and others were actually put on very well. And another thing that when he asked you that how this is done, you gave a picture. It was quite well, but did you tell the actual thing that you will actually it will be done in the endoscopy department? Okay, we will pass the special telescope through the mouth into the stomach. Have you told this word?
No, I didn't wanted to burden her with all the information, and she didn't especially wanted to know the total procedure.
Okay, can you please at this moment answer me that if she asks that, okay, doctor, you told me that there is a stomach, okay, just behind the uh, just below the chest and below and behind the chest. Okay, so how would you reach that?
Okay, actually, we can reach it through two ways. One is under the guidance of a camera. We will introduce a camera through the mouth that will come to the stomach and that will pass a light. And
Okay.
at that time, we will also make a hole on the tummy. And
Yeah.
after making hole, we will enter another camera
Yeah.
through this hole in the tummy, and that will guide us that where the stomach is and where the camera end is. So by this, we will ensure that we are going to the right place.
Oh, that's very good. And I think in this stroke patients, I think that the PG tube can be good, but I don't think that in other conditions like dementia, Parkinson's disease, end of life care, this PEG tube may be given, but this may not be very much helpful as well. Okay, are you uh, do you think the same way? I think that in stroke patients it might have some use.
Yes,
Okay, in solving
it's a
problems.
patient whose that is called gastrointestinal tract is intact.
Yes,
We can use that, and that is the
yes,
most effective
but
way.
I think
But who's
some other patients like dementia patients, Parkinson's disease, I think there is some ambiguity whether it is very helpful or not. This PGT.
yes.
Okay, so I'm just giving this for information. I'm just checking it with you. I think that that is the case with PEG tube, if I'm not wrong.
Okay,
Okay. So anything more that you would want to add?
I cannot remember.
Okay, and there is another thing that uh, usually uh, what can be, is there any condition when you can just enforce this treatment in a patient?
Sorry.
Is there any condition when you can enforce this tube treatment without having having his permission, his or her?
Yes. We can do it if consultants think that this is this is for the best interest of the patient. When patient cannot give consent, at that time we can do this. We can at that time we will just inform the patient's family, and
Yeah,
we will do that according for the best interest of the patient. If patient that doesn't have any previous advance directive or any previous will to say stating that he will not do this procedure.
yeah, that's all right. And can you please name one condition in which this can be done? Any disease condition?
I cannot get you actually.
Is there any specific disease condition when you can give this do this maneuver without taking permission?
Yes, for the motor neuron, advanced motor neuron disease patients, we can go for that.
Okay. Simple answer would be, I think, psychiatric condition like anorexia nervosa.
Yes,
Okay.
anorexion also. Okay.
You can treat and detain the patient and give this type of medication. Okay. Sorry, this type of intervention. Okay.
Okay.
Okay. So I think that's all for the case. Okay.
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 Thank you.
Thank you. Okay. Thank you.